All right, and we're live. We're going to kind of take a couple of minutes before we get started here so that people can join the stream. Very excited for tonight's webinar, today's webinar, depending on where you are. It's tonight over here in Israel. I assume we probably have some viewers all over the place. So good morning, good afternoon, good evening, wherever you are. My name's Alana Goldberg. I'm the CEO of Enigma. And we're going to be tackling a really important topic, specifically in the medical and kind of therapeutic cannabis space, but really I think this is relevant for cannabis consumers across the board. We have an incredibly impressive, I think, panel of experts here to pull apart this topic, who I'm going to introduce actually now. Let's go ahead and introduce you guys. So I'll get you each to have a wave because we don't have your names on the screen right now when I introduce you. And then we're going to jump straight into kind of pulling apart the topic. For anyone watching live, we'd love to hear your questions. We'll take a few minutes to answer questions at the end, but feel free to pop them in the comments throughout the webinar. And we'll answer them as soon as we can. Oh, it looks like my video froze there. See if I can fix that while I'm introducing everyone.
We can hear you just fine, but the video is frozen.
All right. So at least that. All right, so let me start introducing everyone. So first of all, we have Dr. Dustin Sulak, who's a renowned integrative medicine physician and also the founder and medical director of Thca. Dr. Sulak, if you want to give everyone a wave. Oh, I waved, but no one can see me. So, still frozen. All right, well, everyone knows who Dr. Sulak is now. We also have Dr. Cody Peterson, who is a clinical pediatric pharmacist who specializes in medical cannabis, and he's also our scientific advisor over at Enigma. Really excited to have you on, I think, the third webinar in a row now, Cody, right?
This is my three-peat. This is it right here.
The three. Oh, why am I frozen like that? Not what we want. Okay, we'll continue. Perry Davidson, who's an inventor and cannabis technology specialist. He's also the founder and CEO of Psyche Medical, also based over here in Israel. Perry, really happy to have you with us today. Perry, give everyone a wave so they know which one you are. Anyone who doesn't know.
Great to
Perry
be here. I was on mute.
You're not frozen as well. Oh, you're muted. Okay. That's easier to do. Then we have Dr. Ruth Fisher, who is a researcher, modeler, and analyst, and also the co-founder of Can Dynamics. I'm sure we're going to hear a little bit more about what you're doing, so we can give everyone a wave there. I guess it's probably a little bit more obvious which one Ruth is there.
Yeah, the one.
Yeah. And finally, we have Oprah Smith, who's an entrepreneur and cannabis dosing specialist. Spot on. Obviously, I think it's pretty obvious why you're here. And the founder and CEO of Tetragram. Really excited to have you all with us. Cool. So I think to get things rolling, first of all, Cody, I'd love it if I can kind of jump over to you. If we can start kind of pulling apart the issue and frame it. The question of why we're even speaking about this today, why dosing is such an important topic when it comes to cannabis. And
of course, in a punny way, why it's such a drag and why this isn't everyone's favorite topic. The truth is that cannabis is a rather difficult medication to dose. When we look at most Western medications, it's composed of one, maybe two active ingredients. As you'll hear some of the individuals on stage, cannabis may have more than that. And even if it doesn't have more than that, even dealing with, let's say, two active ingredients can be highly variable with cannabis. Two individuals can consume the same amount of cannabis, maybe even the same variety, and get quite different results. And so that's really quite a puzzling scenario that comes up there. And what we really need to really hone in on in this medical cannabis science space is what is the right dose for the right individual, and how do we get to the right dose, the effective dose, without overshooting and essentially developing tolerance and increasing our risk of adverse effects. So cannabis dosing is no doubt one of the biggest challenges, especially for the novice user. And this is usually expressed either in an inability to feel the effects of cannabis, whether that's an inability to inhale an ample amount or tolerate it, But then it also puts new users at risk of consuming too much, and then dealing with some of the less pleasant side effects of cannabinoids, in particular THC. But there's quite a few out there. So I think it's because everyone has to address dosing before you can use cannabis. And you have to decide which way you're going to take it, which product you're going to take. And you might even need to be thinking about how you want this product to make you feel and what your goals and objectives are. And again, I know some of these other individuals on stage can kind of elaborate on that further.
Yeah, definitely. That's an awesome start. And you'll all be pleased to see I got my camera back. So it's just a great day for tech issues all around.
It's the small things. It's
the little things. Exactly. Ruth, I'd love it if you could kind of start pulling apart this issue of how patient expectations are really different when it comes to cannabis. I think, Cody started to touch on that. And I know that's an area of specific expertise for you.
So, when patients come to medical cannabis, typically they're thinking of their regular experience in medicine. And the way that works is they go to their doctor, and their doctor generally decides on a medication, and that can take some patient input or not. And then he determines a dose, and he gives the patient a prescription. Then the prescription goes down, the patient goes to the pharmacy, and there's a certified pharmacist there who takes the prescription that the physician gave him, goes into the back, picks out from among the hundreds of different bottles there, picks out the one that's right for you, hands it to you, and gives you any odd instructions that the doctor might not have given you. So really, for patients, it's a very passive experience. There's not a lot of thinking involved. They just kind of follow the directions. And I think that, they come to cannabis, and a lot of them, are told that it's different, or they know that their doctor isn't really giving them guidance. They're kind of going into the dispensary, know that they kind of have an idea that they're sort of on their own. But I think it's not until they get in there and see all the different products in the dispensary and realize, oh my God, I'm the one who has to decide which of those particular products is right for me. Now, they often turn to the bud tender there, and this is why one of the reasons why education is so important. But they're putting their faith and trust in bud tenders, many of whom aren't adequately educated, which is a shame. But really, it's up to the individual consumer to determine which product they want to use. And of course, the cannabis products don't come with dosing instructions like your medication bottles do. So they buy their cannabis, they have an idea about dosing. And then another thing that turns out to be really frustrating, I think, is if you look at a regular bottle of medication, so say a bottle of Tylenol, that will tell you the number of pills, say 10 pills or 50 pills, and it will tell you the dosage per pill. So say 500 milligrams or 100 milligrams. And that's pretty much all the information on the package. And so it's 2 pieces of information, and that's really all the patient needs to know. If you look, on the other hand, at a package of cannabis, and I know labeling is different from area to area. I'm in California, and we have a lot of different requirements. And among those is you see the amount of nominal ingredient, nominal dosage in the container on the bottle. It'll say like 100 milligrams. And that's kind of the target that the manufacturer is hoping to get. And in addition to the 100 milligrams, you'll see a sticker on the bottle, which is the certified lab results, which might say 102.3 milligrams. Now, that's really confusing. I mean, what's going on? Is it 100? Is it 102? Why are there 2 different numbers? And then you also have the total THC in the bottle. Oftentimes you have THC, THCA, then you also have CBD, CBDA, and it tells you how much in the total bottle, 1,000 milligrams. Where on the bottle of Tylenol do you see that the whole bottle, if you take all 50 pills, is 12,000 milligrams of acetaminophen? You don't see that anywhere. So seeing 1,000 milligrams on this package of cannabis, it's the point is there's a lot of information there, and most people don't know what any of the terms mean. What is total THC? Why is that different from THC, or THCA? And so really, it's a very different experience. It can be very daunting. And I think that bud tenders especially need to be aware that consumers are probably going to be overwhelmed. And they need to also be aware of the perspective that consumers have, where they're coming from. Because if they don't know where consumers can come from, then it's much more difficult to get the trust of the consumer, that the user, that the bud tender knows what the user is experiencing, can alleviate those stresses or concerns and help guide the patients in a very appropriate and credible way.
Thanks, Ruth. I think that really kind of fleshes out the issue, especially from the patient side. And I think it really points to something that I know Dr. Sulak is a real kind of passion and belief of yours, is that this kind of paves the way for patients to take a more active role in their own treatment and in their own wellness. Can you speak to that a little bit?
Sure. And I think that this active role isn't necessarily to have to bust out a calculator to try to interpret what the label says, or maybe even a little graduated cylinder to count how many drops are in a milliliter. We love using liquid medicines because they're easily titratable, meaning you can make very small incremental dosage adjustments. But if you don't know how much is in one drop, that makes it really hard. So, but moving on to taking an active role in the treatment, cannabis doesn't require this, but to really fine tune and optimize one's therapy with cannabis, which is the goal to maximize the benefits and minimize or completely eliminate negative side effects, one needs to have a feedback loop with how they're responding to each dosage adjustment. And so, typically a patient, in my experience in my clinic and with other colleagues in the field, a patient's given a method for figuring out your optimal dose, instead of, like Ruth was suggesting, here's what you should take, blindly, mindlessly go follow those instructions. The cannabis clinician is usually giving a method, and that method includes a starting dose, a route of administration, a frequency of how often to take it, and then a plan for how to adjust that dose periodically over time. Say, start at 2 milligrams. So maybe someone who's having trouble sleeping, I tell them take 2 milligrams of THC before bed, and every other night increase it by 1 milligram until you get great sleep. Or if you wake up groggy the next morning, reduce the dose by 1 or 2 milligrams and don't go past 20 until we follow up. And so this is a method that's, pretty easy for people. Did I sleep well or not? I've had a couple nights at this dose to figure it out. But still, asking this question, how did I sleep, is an important participation of the patient. But when we're doing something less obvious, like treating pain or looking for improvement in function, reduction in anxiety, enhanced performance, better focus, these nuances really require the individual to be able to check in with themselves and kind of read or gather some type of a subjective metric on how they're feeling in response to a certain dose. And so also to comment on your point, Ruth, with our healer products, which we have in Maine and Maryland, as well as our hemp products, which are across the U.S., we include a little worksheet. There's a dosage guide that tells you where to start and how to titrate if you don't have a clinician telling you how. But I think probably the most important of that guide is the worksheet at the end, where we're encouraging people to do what I call the inner inventory. It's just a self-assessment of how you're feeling, and record that before and a certain period of time after using cannabis. Now, while that's so essential in getting the dose of cannabis right, that's also a wonderful experience for the individual. I think so many of us are really disconnected from how we feel. And if part of our pathway to having a healthy relationship with cannabis also means having a deeper connection and relationship with ourselves, that's just another healing attribute of this whole process.
It's really an issue of empowerment and having the patient engage in their own self-care rather than abdicating that responsibility to someone else.
And really essential for individualized medicine, which I think hopefully is where we're going. And great point.
Yeah.
Yeah,
Sure.
I would agree as well.
When we talk about it, go ahead, Otha.
I was just going to say I agree as well with what Ruth had mentioned, is that it really, the key word is empowerment. And so with Tetragram, by providing the consumer with the ability to keep track of the products they purchase and be able to draw conclusions at the end of the day about what products are most effective, which consumption method really meets the target, is that empowerment within itself, so that they can understand their journey and figure out what works best.
Yeah, definitely. I think also, there's something that you just mentioned, the consumption method or the delivery method is key here. And Dr. Sulak, you mentioned that you prefer oral methods. I was wondering if, Perry, maybe you could speak a little bit towards your work and what you found in the inhalation space.
Yeah. So first, what just Cody and Ruth and Oath have said previously, cannabis dosing is like a multifactorial equation you're trying to solve. There's so many parameters that are in that equation, try to figure out which one is right for the right patient. And what we found out at Psyche, that there's even a more deeper problem in that these actually factors in that equation are actually jumping around by themselves. So the actual absorption of the drugs by the different modes of delivery is very, very variable. Now, oral intake, as Dustin, I'm sure, prefers for many important reasons, has its benefits, but also has some challenges in terms of the sometimes erratic absorption because of your different either metabolism or your first pass through your liver, all sorts of changes that the actual consumption causes to the drug itself. It might not always be consistent in its effect, depending on our bodies. While inhalation usually bypasses that entire system and pretty much goes to your bloodstream straight away. That's the closest thing. Again, Dustin, feel free to correct me here from your professional side, is that the inhalation is more like IV, like intravenous, goes straight to the vein. Our lungs is such an amazing organ. If you spread it out, it's like the size of a tennis field. So the absorption capabilities of our lungs are quite intense. So that mode of delivery is what Psyche opted to try and really crack and provide a meter dose solution. And to touch on that point of that Dustin just mentioned about empowering patients, which is such an important thing to do for the majority of patients. That's what I've been doing before Psyche as well. But what we're trying to do is really take that know-how that all of you guys are really developing and make it accessible to those patients who are unable to be really empowered, like children, elderly people who just need that solution to put in into their regimen and go, and are unable to be so involved in the treatment itself. They just need to get it back to their lives. So that's what Psyche is trying to do, to really standardize that treatment in that way.
And I'd love to respond briefly to you, Perry. Thank you. So, and I don't want to portray that I'm an advocate of one delivery method over the other. I just used oral as an example. Lots of my patients inhale, and I think it's extremely effective. I would say the vast majority, certainly more than 50% of the cannabis patients I'm working with are using more than one delivery method for different purposes, as they really learn how to weave cannabis fully into their lives in a way that supports a number of different things, including their primary chief complaint that they presented with, and then all these other issues that show up. And I think one of the biggest challenges with inhalation is getting the dose right, and to be able to inhale in a precise dosage is extremely valuable.
There's a lot of trade-offs in cannabis when it comes to cannabis as medicine. The consistency, the accuracy, the metering of the dose. And what's really interesting is the different methods of ingesting cannabis. Really, each one has a bundle of positives and negatives, and so each person is going to be different. And the idea of mixing and matching different forms of administration is really a beautiful thing in cannabis, that you don't have that in a lot of other forms of medication.
I think it's so cool how cannabis has so many different uses, right? And so just by changing our route of administration, we can sort of derive a little bit different benefit. Inhalation might help for some more acute symptoms, and we can also layer in, like Dustin often recommends, layering in an inhalable and an ingestible or a sublingual to try to layer your regimen and really be able to provide sort of that full gamut of benefits from cannabis. And again, Perry's talking about the Psyche inhaler, which is a dry herb inhaler, that in itself is different than smoking, right? So a dry herb vaporizer is different than smoking, is different than a vape pen, is then also different than smoking ingestibles, sublinguals. So there's just this really large, diverse group and approaches we can take. And so I think it's really overwhelming. I think it really is. I think patients are overwhelmed with all the options and aren't sure where to start. And I think that's why you got this group of bright individuals on this phone call.
Yeah. I think it's,
just to touch on what Cody said, that overwhelming feeling of what is the patient supposed to do? And I think it's maybe even worse for a physician to know what to prescribe to his or her patient, is what we try to tackle again about 10 years ago. And we try to find what will be the basic quantified pixel, if you will, of a dose of cannabis. And you can look at it from the top down view, like what's the percentage of THC, what's the strain, the entourage, etc. But really what it boils down to, how much do you have the active ingredient in your bloodstream? That's if you will, and from the tech side, you call it the ground truth. That's how much of that substance is in your bloodstream. So if you can really control that in a very precise way, you could expect to have a more predictable outcome of the treatment. And that's what we were successful in doing in Psyche. And I'm happy to share in this forum some of our recent clinical data. We did multiple clinical trials to show what is the actual correlation between a blood level in terms of nanograms of the THC in the bloodstream to actual effects that we all are trying to resolve in different ways. So that's what we were trying to do, really get to some sort of ground truth we can anchor and have a proper conversation over dosing.
Yeah, and I was just going to add as well, is like when we look at some of this anonymous data that we're collecting on the back end, to add to Cody's point, inhalation is always the most common method. And as we look at people who are using bongs, the number of puffs that they take is dramatically different than what they would use if they were using a vape pen. So it's really interesting to see like how much dosage is needed given the delivery device that you're using in order to meet the expectations that you're looking for.
Right.
So it would be great.
Stuff.
Sorry, Perry, I cut you off there.
No, go ahead.
I was just going to say, I think it would be great if you could even back up a couple of steps and speak to journaling when it comes to starting off on a medical cannabis treatment plan, how it can be useful and how it can be help patients find their effective dose and their effective, I suppose, delivery method also in product faster.
Yeah, so I always like to use my personal experience. I've been using cannabis ever since I was like 16. So when cannabis became medically legal in the state of Maryland, I jumped at the opportunity, got my card, and it was a little egotistical to a degree. It was like, I know everything there is to know about cannabis, right? But surely I was wrong, because there was this terpenes and cannabinoids and different consumption methods that were just completely foreign to me. And so there was a recent report that was published that said 60% of people don't feel confident that their doctor can provide the proper recommendations on what to use. And so, customers today, whether you're CBD or cannabis users, you're really on this journey of self-diagnosing in order to find what works. And given that you walk into any dispensary, you really have a Walmart selection to choose from, it becomes very intimidating. You really don't know where to start. And some bud tenders are better than others, but it's natural for these bud tenders to just make recommendations based upon their own personal use. So taking that experience and then saying, wow, you really need to document each product that you use. But more importantly, not just the product, but the terpenes and cannabinoids associated with it, because that's the true underlying value. And then how you consume that product is really going to be key into developing a roadmap that you can look back on and say, this is what has been most effective to me, because, given the legal standing of cannabis, and there's just not a lot of avenues that you can rely on to try to give you that head start. One of the things that's really key to Tetragram is that we also have a community side, which people can share their reviews anonymously with each other. So you can search for a product, or you can search for a product based upon a medical condition, so that you can have somewhat of a head start when you enter the dispensary, looking at crowdsourced data to see what people have rated as being effective, and then what was that method of consumption, so that it might be in line with, your ways of consuming cannabis. But, keeping a journal is definitely going to be key. in order to draw these conclusions moving forward. I mean, me personally, working in the cannabis space, it took me 2 years before I was able to find the right product, the right dosing amount, and the right delivery method that best suited my needs. And so it's I just always advise people to be very patient, because it does take time. But the best thing that you can do is document these experiences, because it's the most effective way to draw conclusions.
Yeah, I think you really hit the nail on the head there when you said that it can give you a head start. That's the point, is that you're not going to get a definite answer from any of these tools, from any expert that you consult. But, you know, the best you can do is kind of get a few steps ahead and hopefully kind of shorten that trial and error process.
Yeah, 100%. Because, you know, like Ruth said, the key word to our company, something we really harp on, is empowerment. Because by the consumer documenting their experiences with these various products, they're going to be more empowered to make better purchase decisions. And then all this aggregate data that we collect anonymously will also help the bud tenders, dispensaries, cultivators, and medical professionals really have a better understanding of the efficacy of the products out there today.
I think one of the things that's key for new consumers is to just start somewhere. Just pick a product, start, see how it works, and understand that you're going to be moving towards your ideal dose. You're never going to start at the right place. And really, you know, just to get over the fear factor and the unknown, just start somewhere, and then figure out, maybe using Otha's technology or some of the journaling methods that Dr. Sulak was mentioning, figure out a methodology to use to go from where you are towards where you want to be.
I want to add to that. Just want to add to that I think it's critically important to understand that finding a right dose could be on the low end, and that's the admirable work that Dustin is doing there. And you can just as well find a high dose that is also balanced in a way, which might be muddled a bit with tolerance in that way. So what we found at Psyche is that our patients are actually stabilized on about 1.5 grams a month. That's the amount of cannabis they're consuming in essence. It's about 1,500 micrograms of THC per day. Now, that's a very stabilized dose. Our patients are reporting great clinical outcomes, pretty much no adverse events, and all the efficacy that's been seen in cannabis as well. Now, that's a stable dose on the, I would say, on the left side of the dosing curve. Now, as you build up your dose and you might develop more tolerance, you might need more of the actual drug to get a similar effect that you had before. So you need to be really cognizant of the place and that U-curve dose response that THC probably has, which side of the curve you're at. And I think Dustin does a great job of making those patients start very slow, that they don't cross that threshold and become on that either left on the right side, which might have these more chronic adverse events that would follow in that type of usage.
And I'll just follow up with that. It's a great point, and it gets a little more complex even when we consider that different areas of the brain likely build tolerance to THC at different rates. So that curve may actually be in one place for movement or motor control, and it might be in a different place for anxiety and a different place for euphoria. It could also be heterogeneous throughout the body, right? So certain bodily tissues may do better with a higher dose and other with a lower dose. And I know this sounds like incredible complexity, but what's beautiful about being a sensory being is that we can kind of collect how we're feeling all together as we go through these low doses and gradually increase and understand like where's that sweet spot. And I guess I also want to, for the listeners, point out that while it sounds complex and while cannabis dosing can be a drag, and we have a lot more to learn from it. You know, I've spoken with hundreds or maybe thousands of people that have just stumbled into this with no guidance and really little education and have actually figured it out pretty well. You know, it doesn't happen all the time, but I think a lot of people that just, feel themselves and kind of think about what they're doing and pay attention. This isn't rocket science for a lot of people.
I guess arguably we've been doing this for thousands of years, right? I want to start jumping. Oh, sorry, go on, Cody.
Well, I just think that there is a real formulaic approach to dosing cannabis, where we sit here and we say, everyone is different. The complexities of the endocannabinoid system are so vast and broad that different parts of your brain respond and develop tolerance differently. That's how complicated it is. And Dustin's absolutely correct. But because of that, right, then now we need to simplify our approach in a structured, standardized, mindful way so that we can actually hone in on how this medication might be affecting us, because you might metabolize it far differently than your neighbor, or your absorption through your lungs might be significantly better than your neighbor, although that one's kind of rare. But the point being is, I really think, even though we're talking about how complicated it is, for that reason, most of the individuals I think on stage would say that, yeah, coming across like a very standard approach and in a mindful way is the best approach.
Yeah, absolutely. I was just going to say before I was cut, let's start looking at a few questions that are starting to come in from our viewers now. And I think one that stood out to me so far from Tracy Yates, I'll just pop it up here on the screen for you so you can all see this, really kind of speaks to this word that's coming up over and over again in this conversation of empowerment. So at the same time, while we're empowering patients, where does that put the physician in this whole story? So I'll just read out her question. In a state that has just legalized medical cannabis, how do we help our clinicians to feel more comfortable with patient control versus the normal, comfortable way of prescribing meds? Anyone want to jump in on this one?
I think that doctors need to understand that patients are in charge, and they've always kind of been in charge, but that's kind of an odd way to say it. But I think doctors can learn with their patients and can learn this new methodology that Cody mentioned, that this purposeful way of approaching cannabis, and the doctors and patients can learn together how to approach this complex medication in a productive and as efficient way as possible. And I know that doctors aren't comfortable often with ceding control, but I think that that's really what it comes down to is really working with the patient. And this is the true nature of patient-centered care that the healthcare industry has been touting. So I really think it's just kind of embracing what the industry has been touting for probably 5 or 10 years now.
And I would also add that if there's a way for the patient to actually show the clinician, especially quickly and efficiently, what they've been doing, like say some of the tracking that Oath has developed, and I think a big part of patient-centered and personalized medicine, one of the challenges is that these docs that have 10 to 15 minutes per visit really can't afford the time to dig in and actually perform the interview. And so I think one thing that would make patients more comfortable is some kind of a summary that would make doctors more comfortable, a summary that the patient could give over to show them that they have been tracking this, paying attention to, and reporting it back to their provider.
Yeah, I agree, Dustin. I mean, that was spot on. I mean, I can't give away some of the goodies of version 2 of Tetragram, but that direct connectivity between patient and doctor is something that we really pride ourselves on with these new features that we're developing, because to Ruth's point, doctors need to roll up their sleeves and just be on that ground level with the patient. I think it's the only way for them to really have a substantial understanding of what's happening in the patient's lives, and then to just multiply that hundreds and thousands of times over as they speak with other patients as well.
All right, let's move on to our next question here. I'm just going to pop it up on the screen. Oh, they're coming in fast now. Everyone who's viewing, feel free to shoot your questions in the comments. Now's the time. So our next question is from Wendy King. Is there a way to dose dated without building tolerance?
Yeah, sure. I mean, I can jump in there. I'd say that finding one's optimal dose means that you're not building tolerance. And people can stay on the same dose for years or decades without building tolerance. If you are building tolerance, it means that that dose that produced the tolerance was too high for you. And after you reset your tolerance, you need to try again at a slightly lower dose and try to avoid that. And sometimes at a different delivery method. Perry knows I'm fascinated by the ultra low dose range. And I think that many people people are vastly overshooting the amount that they need to take, both via inhalation and oral. And then, as Perry suggested, there's also some people that do very well with very high doses. So, this common acronym or saying, this cliche of like start low, go slow. A lot of people don't finish it, which from my training, it was start low, go slow, and don't be afraid to go all the way, because you'll have outliers in the very low dose range and outliers in the very high dose range, and a lot of people in the middle. But pay attention and go through a methodology. And if you build tolerance, that's a learning experience. One of the beautiful things about cannabis is that it generally just takes 48 hours of abstinence to reverse tolerance. We have a whole program on healer.com called the sensitization protocol, which expands it into a total of a 6-day process where you're really deepening your kind of self-monitoring skills and using some other activities and foods and things to replace the cannabis during those days of abstinence. So I hold your hand through the sensitization protocol. But really, sometimes to learn where our set point is, we have to go a little outside of it and receive that error signal. So, for those that are viewing, I would suggest if you have built tolerance to cannabis, it's far from the end of the world. This is actually useful information that will guide you toward a dose that does not build tolerance.
Yeah, I think that's absolutely true. If you're in that tolerance building phase, that means your dose is already pretty higher than what your body actually needed. And we've seen, again, in our patients for over 3 years now, we're following on some of our patients. They were locked at 1,500 micrograms, that's 1.5 milligrams a day of THC for 3 years, and they're not elevating that dose. A lot of interesting things going on the pharmacological side. You're ingesting not more than what your body can actually eliminate. So you can actually cycle that through in your body, not absorb it in your fatty tissue, etc. And then you get that chronic slushing, if you will, of your THC in all of your bodily systems. And just one last thing that Dustin said, it's interesting to investigate, is that high dose really clear of all the side effects and it works well for everyone? Could be that chronic use, that desensitization of your receptors to a certain degree can have more chronic effects on your body, such as sleep quality and things like that. So what we're seeing is that you should try and always get the minimum amount of dose for the highest bang for your buck, if you will. I think works also in the clinical side. Use as little drug as you can to get your quality of life back on track, and that will have the least amount of complications maybe in the future.
And the time preference is also a big issue here. Some people want to take their first dose and feel all better right away. They sometimes will emphasize the short-term benefits at the expense of the long-term sustainability of their treatment. And so, I ask my patients to be very patient with me and, let's give this a couple weeks, if not more, to titrate slowly and find your optimal dose. And then we'll have a sustainable long-term effect.
Right. I'll just add to that. We have a full nursing team that accompanies our patients on our average titration plan. The time they are reaching their actual optimal dose on average is about 25 days. So that's where it takes our patients to really find that balanced dose.
I just want to throw the pharmacist 2 cents in here. In addition, ratios can be an important component of building tolerance. So consuming all type 1 high THC cannabis you may develop tolerance faster than if you used a more balanced strain containing CBD, CBG, or another cannabinoid. So there's another strategy that you can implement, is varying the cannabis product that you might be using or using a more balanced product.
And along those lines, the temperature also. I'm curious too. I've got a question for you, Perry, if you don't mind. I'm wondering about the delivery of THCA versus THC via the inhalation route.
Right, absolutely. So I'll answer that and just what Cody said. When you're saying balanced strains, you're by definition taking more room of cannabinoids from THC to a different cannabinoid. So you're by definition lowering the dose in some ways when you're adding more balanced strains most of the time. There are some very high balanced strains, and there's a lot of interaction between CBD and THC on your receptor competition. So it might be even slowing down the actual THC perception. So it might be just a dosing question that when you balance those different strains. And Dustin, yeah, you're absolutely right. That actual aerosolization profile really changes the THCA into delta-9 THC. And at Psyche, we have some interesting tech that we're able actually to control that ratio of THC to THCA in the actual aerosols. So we're actually able to get an interesting effect of THCA straight into the bloodstream, which is usually very hard to do in oral intake because it gets pretty much degraded quickly there. So a lot of interesting stuff. But again, as I mentioned, we're trying to first figure out what is a delta 9 THC dose correlation to effects in a human body. Where is that dose starting to become psychoactive? And as Otha rightly said, different modes of delivery in the inhalation space have different effects. You take a water pipe and take a few hits, that's a completely different psychoactive effect than smoking it through a joint or through an e-cig. That dynamic of that inhalation pattern has tremendous impact on the actual psychoactivity or even efficacy for that regard. So there's a lot of science to nail down just on the delta 9 THC in the bloodstream before you go into even more parameters and their interactions, which is compoundedly more complicated. But yeah, it's fascinating stuff. We're really looking forward to getting some insights in that THCA injections.
Yeah, we'll have to do a round 2 when you've got that data. I'm going to pop another question up here, which I think is really fascinating. I know that in the comments here, we've thrown an article that we just put on the Kenigma on this topic. And in general, all of these topics that we've been talking about, we've got a number of different resources in the comments from Hila, also from the Kenigma. So make sure you have a look through the comments as well, anyone who's watching. So our question now is, what are your thoughts on about how set and setting can factor into dosing?
Well, I could just start and suggest that cannabis, like a number of other psychoactive substances, especially the psychedelic medicines, can be an amplifier of what we're already experiencing. And so this has been known with cannabis, for 50 years now in the literature, that the environment in which someone takes cannabis can impact how it affects them psychologically. Take it in a stressful environment, you become more stressful, more stressed, and vice versa in a relaxing environment. But that's just kind of the surface. I think that the internal set, the mindset, can be extremely useful for purposely using the consciousness altering aspects of cannabis to create a healing response. And that, and I, often say that this is one of the most powerful therapeutic aspects of cannabis, because those healing experiences that happen with intention and mindfulness and in the psychoactive dosing range, those benefits can last much longer than the acute effects of the drug. So the cannabis can wear off, but someone can be left with this new perspective on their challenges, or this new feeling of connection to the people around them, or to God, or to nature. And that persists sometimes indefinitely. And so I do think that set and setting, especially using cannabis for this kind of psychoactive therapeutic effect, is extremely important.
And I also want to add to that, so absolutely it's critical, I think, set and setting, but I think as you become more precise with your delivery system, your concern for that might go down as well. I'll give you just a short story about my dad. He's a psychiatrist, and I've tried to give him, he has severe back pain, he's 88 years old. I tried to give him joints and all sorts of modes of delivery before Psyche was available. And he always said, I'm too high, I'm too disconcerted, it's really making me nervous. And he never wanted to use it again. And when I started him on Psyche, he started using it. And similar to what Dustin is doing with his patients, slowly titrating before reaching any of those psychoactive effects, which would require some set and setting, I would say, comfort. And I came to him after a few months of use, says, Dad, are you feeling high or anything for that matter? He says, no, I don't feel high, my back's feeling better. And my mom is next to him, says he sometimes talks too much. So he had that sub-psychoactive level that he reached, which he didn't even notice that he was there. But that's exactly, I think, the sweet spot of good treatment for these patients. So he didn't have any concern about set and setting, was just living his life. But we just brought him to that optimal dose with those very minute dosing increments in that process to avoid that. So again, high precision dosing might make that less of a concern.
I think it's really important what you're kind of separating out here, Perry, which is the difference between psychoactivity and adverse psychotropic events like anxiety or paranoia. Right. And I think it's, really important that we can kind of be, like you were saying, Dr. So really conscious about this and mindful about the impact of these different effects. Perry, as you're talking specifically about Psyche, I wanted to throw another question up here. From Patty as to whether or not Psyche is available for personal use in the US and question price.
So unfortunately not yet. Psyche is available in Israel. It's coming into Canada later this year and then Australia. US is of course in our crosshairs, but there's still ways to go through the federal path that Psyche is most probably going to undertake there. So not yet, Patty. Really hopeful this will be as soon as possible available.
All right, great. Cody, you look like maybe you had something to say there on the previous comment. Do you want to jump back in?
Yeah, I mean, there's crosstalk here. So my whole shtick is the endocannabinoid system, how complex it is and how intertwined it is in every really human emotion and social engagement and frankly, all the things that we do all day long. And that makes sense because it keeps us in balance and we have to stay in balance at all times or we don't exist as organisms. So the endocannabinoid system and endocannabinoidome performs a really big role. The 5-HT2A, the psychedelic receptor, the one that's targeted by the psychedelics, is co-coupled with cannabinoid receptors in the brain. They are highly present in the same tissues. And so it makes sense that there's a lot of crosstalk. And importantly, cannabis and psychedelics are probably some of the most commonly consumed substances in the psychedelic range together. So while there is we don't have a definitive this is what it does, we certainly know that there are individuals that feel it modulates the effects, many of which would report beneficially. But again, that seems to vary a little bit from person to person. But the crosstalk between psychedelics and cannabis is real. If you recall, during Reefer Madness, cannabis was actually classified as a psychedelic. And now it kind of gets its own class. It's like this utility herb that does all sorts of fun stuff.
Yeah, it's another good point. I mean, I think at some doses it absolutely is a psychedelic, and it can last longer than most of the classic psychedelics, and is now being used in psychedelic-assisted therapy, where people can get deeper into their, kind of like trauma therapy, whether it's somatic-based or talk therapy, with the help of quite a large dose of cannabis sometimes. So this is an emerging field that's also very interesting, kind of bringing it back to the psychedelic utility of this very versatile agent.
We've got a comment here, utility herb, love it. So
hashtag utility herb.
So did you want to jump in there? I thought you were just about to say something.
Yeah, I mean, when we look at people who are using edibles, as we analyze that data, we are starting to see a lot of people who are experiencing some of those psychedelic experiences similar to like mushrooms. And I'm talking from what we've seen, it's anywhere between, 40 milligrams up to like 60, 70 milligrams is where we're starting to see data associated with, more of that psychedelic effect. So, all good stuff that we're starting to see come out of the system.
And it makes sense that orals would too. From the 11-hydroxy standpoint, increased psychoactivity or increased penetration into the brain. So it makes sense that high-dose edibles are more associated with these psychotropic experiences. And also people tend to sort of stack doses or can stack doses where they sort of think it's time for another gummy or a whole candy bar, and then they overshoot. That's definitely a common occurrence. And if we're going to talk about a webinar on dosing, we probably ought to mention that common misstep for the newbies out there. You want to wait at least, I don't know, I'd be interested to get everyone in the panel's idea, but I mean, really 4 hours, 3 to 4 hours before ever redosing with the cannabis edible. What do the people on screen with me think?
Yeah, I agree with that. I think it's a minimal. I would say absolutely no less than 3 hours. People get surprised. And also some people think they know how they respond to an edible because, 3 days out of 4, it kicks in within an hour. But it's certainly possible that on that 4th day, the same dose, same time of day, same person might take 3 hours to kick in. Our autonomic nervous system, which is highly responsive to the amount of stress that's in our environment, changes dynamically, and that affects our gut motility and our ability to absorb oral consumption of cannabis. So it's really got to give it a long time and expect it to be erratic. It usually is.
Especially considering whether or not you've eaten recently, how full your stomach is. That could really affect it.
Exactly. I was going to say the same thing. Like in my personal use, if I, had a good meal, edible would take about 3 to 4 hours. If I just ate an edible and didn't really have anything on my stomach, it can hit me in about an hour. So I think 3 hours is really, the benchmark before you ever attempt to try to eat more.
And the fat content of the food can make a difference. So both THC and CBD can be absorbed somewhere in the 4 to 5-fold greater range if they're consumed with something that's fatty. And so think about that, quintupling your effect by accident. There's a lot of risk there.
100%.
All right, I want us to wrap up here with a question that kind of brings us really back to the topic of the webinar at a really kind of useful day-to-day level. How do you learn the dosage? I'm new to this, Michelle has asked. So I was thinking maybe, Dr. Stulak, if you can kind of walk us through, like, a new patient comes in, what do you do? How does a new patient start moving towards finding the right dose for them?
Sure. Well, so with healer.com, what I really wanted to do, and I think we accomplished this 5 or 6 years ago when we posted all these programs, was to take someone in any jurisdiction that might not have access to, accurate labeling of cannabis products or high-tech, psyche type devices, even though I hope we all get those sometime. I'm looking forward to it, Perry. But this is, a program designed for people that are doing either inhalation or oral dosing to kind of like just hold their hand and walk them through that. So that's a resource that's out there. And we put that on the web because everyone, Michelle, was asking the same question that you're asking and wanting all the patient education material we use in the clinic. What I would say is a little distinct from seeing someone like me in the clinic would be that I would, after an interview, really help identify what your goals of therapy are and how to prioritize those, and then a dosing strategy that's specifically tailored to those goals. And that includes these basic factors. So the type of product you're using, and that includes, is it THC dominant, a blended CBD, the route of delivery, typically inhaled or oral, and like I said, a lot of people end up doing both, but we would pick one to start with, not start with both at the same time, a frequency of how often you take it, what you're looking for in terms of benefits and adverse effects, and then a kind of a maximum dose, and at least maximum until the next time we have contact in the clinic. And so that's the additional fine-tuning that you would get from an office visit with me. But I honestly think if most of my patients just went to healer.com and went through that program first, a lot of them would get really close. So I invite you to use that tool. It's totally free and complimentary.
I would add that there's difference between using an isolate and a whole plant extract. So generally, if you're using an isolate, you might need a higher dose. And I think that you get more mitigation and better effects, generally speaking, if you use an extract rather than an isolate.
Nature ratioed those up nicely for us, at least more often than the formulator did. Some guy with a farm D at the end of his name. And so I think that it's, look, I think that we're moving to a place where you, the watcher or listener to this, can hopefully have access to a provider like Dustin or myself or some degree of a healthcare professional if you so choose to seek it. So I think we are moving in that direction. But for those newbies or perhaps those less complicated patients, I think that kind of understanding the limitations and sort of the entry repeat dosing is sort of the best thing. So a lot of the times with inhalations, I hear from patients all the time, I can't smoke cannabis. It makes me nauseous, right? I tried it with my buddies and I didn't like it. Okay, so the first question is, were you drinking? And that's such an important question because alcohol actually increases your blood THC levels, greatly increasing your risk of adverse side effects. Not dangerous per se, usually, just feeling unwell. Number two is how many puffs did you take? Oh, my friend told me I had to take 3 to feel it. And how long did you take those puffs? Oh, I took them back to back to back, right? And all of a sudden, you see where they made their misstep, right? You should, if you're so new to cannabis that you're not sure what the dose is, you should be taking one inhalation and waiting 10 minutes and seeing how you feel and then reassessing before you take another inhalation. And the same rules sort of apply on the edible or oral dosing side where there is a window. So I agree basically with Dustin's approach. You kind of set the patient up with the starting dose, a little wiggle room to get up there. You give them a place to check back in. And then, you know, cannabis is a safe medicine, generally speaking. So we can have faith and feel comfortable sending our patients out with a medicine that really, from a risk-benefit standpoint, is extraordinarily safe.
Thank you. I agree. I see just a couple comments. Can I respond to them? Yeah, one, I thought Tim's comment is really interesting, that he can eat large doses of edibles, and I'm assuming that you're suggesting these are THC dominant edibles and feel absolutely nothing. I've witnessed this in the clinic. It's rare, but I get several patients a year that could even eat hundreds of milligrams of THC and feel zero, yet inhale and feel something. And I can only assume that there's some inability to absorb or some rapid metabolism happening in the liver or some combination of those two things. But I want to validate that for you, Tim. It's strange, but you know, and maybe if your gut health or gut function improves at some point, then that would be a route of administration that you could use. But in the meanwhile, you're probably going to have to rely on inhalation. And then I thank Sarah O'Hanlon for just bringing this up. I just want to toot my own horn here for a second, that I do have a really comprehensive soup to nuts clinical guide. It's called The Handbook of Cannabis for Clinicians, Principles and Practice, and it comes out in English at the end of June. We were talking about how to educate our doctors and make them feel more comfortable. And my selfish suggestion to you is to buy a copy of my book and give it to your doctor. And it'll really give them everything they need to identify good candidates for cannabis treatment, or to follow patients using cannabis, or to take a more active role in actually recommending this for their patients. Oh, Alana, you're muted.
You're muted.
The old mute trick.
I did it. I did it to pour myself some water before. I was saying it sounds like a win-win-win all around, buying the book for your doctor. All right, so I think we're going to wrap up here. Thanks for fitting in those last couple of comments. I want to thank everyone for joining us live. We had a really good turnout here on the webinar, and especially to our panelists today. Thank you. This has been a really fascinating and important discussion. There's a few questions that haven't yet been answered. We're going to do our best, and I know the team from Healer has been popping some links in here as well to answer all of the questions on Facebook. And feel free to reach out to us at the Kenigma with any other questions, and we'll put you in touch with the right person to answer. Everyone have a great day or evening wherever you are. And we'll see you next time.
That means me, guys. I'll be answering.
Cody will be answering.
Right.
Bye, guys.
Thanks so much.
Time.
Appreciate it, everyone. Have a great day.
Thank you.
All right, take care. Bye.